Good morning, just Patrick here again from Complete Health Eastbourne, and wanted to jump on and discuss why pain is really a secondary measure for me. Why pain is a secondary measure for me. So when we look at someone's body and how it's actually working, typically pain only comes on after a dysfunction has actually been there for a significant period of time. So let's just look at a really obvious example of some sort of health disorder that occurs when someone's actually had a problem for a period of time, and then it overlaps, or the sink overflows because they've been dysfunctional for a very long period of time. So one example I can use is, say for example, something like a heart attack. Someone will typically have high blood pressure, high cholesterol, poor diet, lack of exercise for a period of time before that symptom or dysfunction starts to manifest. And even an example such as like football players having heart attacks on football pitches, because this has happened before, and people will go, well, what's the excuse with them? Well, these people are pushing their bodies to absolute nth degree terms, and really forcing their bodies to do things that naturally we wouldn't be able to do. And so in that scenario, it's slightly different. But we have to understand that when a symptom occurs, or when a dysfunction or a pain or anything that our body is doing that it doesn't feel quite right, this is something that's potentially been going on for a long time. So say for example, if you've got an ache in your knee or an ache in your lower back, the first time, whenever I ask the question, okay, how long has the pain been there for? Oh, it's been there for 6 weeks. Okay, and when was the first time you ever remember having pain in your knee? Oh, probably about 10 years ago when I had a bad tackle in football. And if that thing was never fully corrected, or that underlying cause was never actually taken care of or checked, that's when we see these things massively grow and manifest into much bigger issues. Now, the thing is just because the pain has gone away doesn't mean that the tissue has fully recovered, because what we know is that inflammation can last 48 hours, healing can take up to 6 weeks, but remodeling can take anywhere up to a year. And so if you're not really taking care of those tissues or injuries for long and sustained periods, by the way, it's the same with a heart attack. People are much more likely to relapse in the first 3 to 4 years. Same again with cancer. People are much more likely to relapse in the first few years. Same again with stuff like diabetes, kidney dysfunctions, like pretty much all diseases on the planet. If you cannot sustain the health long term, what ends up happening is people end up relapsing and they have heart attacks again, or strokes again, or cancer again, or in chiropractic instances, they have back, neck pain, shoulder pain, headaches, you name it, it doesn't matter what it is. And the thing is just because one problem is resolved, it doesn't necessarily mean you're going to offset the other one. So say for example, if you come in with neck pain due to a bad posture, you get your posture good enough to get rid of the pain, but you don't resolve it, the likelihood is that's either going to come back or it's going to start to trigger something new again. So don't just use pain. Don't just use pain as a measurement of your function. Think about what it is that's actually going on with your body, and why longer term correction might actually be necessary in order to sustain the reduction of your injuries, problems, health issues. Just think about it, all right? Just think about it. If you've got any questions, please ask. Maybe you're suffering with a pain or a problem, or maybe you've seen someone and that problem isn't going away. We're here to help you. We're here to try and help you understand. I'm here to answer questions. It's just what I enjoy doing. Until tomorrow, Patrick here from Complete Health, and we'll speak to you soon. Do not use pain as a measurement of your health. You will be severely disappointed. Take care.